privileged now to go on to the next speaker. He is no other than Dr. Silva. And Dr. Silva, I think, is very well known. Okay, he's very well known. But it's my duty to go through his CV, all right, to give you an introduction. He is the senior ONG consultant, and he is a subspecialist in reproductive medicine at Makota Medical Center. He does everything, okay? You name it, he does it, okay? And he's an excellent laparoscopic surgeon, hysteroscopy, and he does significant IVF work in Malacca itself. He's done more than 8,000 cases. He's published a book, which all of us have. And he started the ultrasound-based HIFU, okay, with very good success outcomes. Without further ado, I call upon Dr. Silva to speak to us on improving pregnancy rates with the use of anti-adhesional contents, or anti-adhesives. Dr. Silva.
Thank you, Kana. Let me share my screen. Okay, good morning, everyone. Thank you for allowing me to give this lecture, and thank you, Kana, for the kind introduction. My topic is on improving pregnancy rates with the use of anti-adhesions, and I'm going to introduce you all to a new product called 4DryField. Now, this is a sponsored talk. This is my disclosure. Now, 4DryField is actually a powder consisting of sterile hydrophilic microparticles. It is manufactured from highly purified polysaccharide in a complex process. Now, this is how it looks. It comes in a pump-like structure. We will show you how it works. It's patented product by Plantech Medical Germany. Now, 4DryField is the only CE certified product indicated for hemostasis and adhesion prevention. And there are more than 10,000 surgeries performed using 4DryField successfully. Its proven efficacy and well documented. It contains no component whatsoever of human or animal origin, so there's no worry about halal factors. It's proven safe, and 4DryField remains in the body for 5 to 7 days, after which the body's own amylase will digest and absorb it. So today I'm going to introduce this, and also at the end I will just give a case of my experience using it. Now, first question is it safe? Now, this is the study that shows that 4DryField is not cytotoxic and does not enhance viability of tumor cell lines. High dose of DryField of 1.05 grams per kilogram body weight is well tolerated and reduces weight loss in animals with peritoneal injury. Its biocompatibility for 4DryField can be rated as being excellent. So it is a very safe product, and it's been used for over 100,000 cases so far. Now, if you look at it, it has actually got two benefits, which is adhesion prevention and hemostasis. And that's the reason why I was excited about this product when it was introduced to me some time early this year. Now, first, let me look at the hemostasis effect. Now, the mode of action is that it has got a hydrophilic microparticles extract the water from the blood, thereby concentrating clotting factors and platelet, and causes acceleration of the coagulation cascade. Now, this is how it works. You place the particle onto the area that is bleeding, and the particles will then absorb the water from the blood of the blood into it, and it will concentration of the coagulating factors causing blood clotting. And once that happens, within seconds, there will be blood clots formation. And this is an animation showing it. So this is a bleeding area. The first thing to do is actually to try and remove as much of this blood as possible. And then you apply this powder onto that area. And once it's placed, you can actually place a gauze to apply some compression. And what happens is that these particles will then absorb all the bloods, and because the blood is absorbed, it concentrates the area and promotes fibrin formation, and then causes a clot to be formed. And it works very fast with this in this way. Now, this study shows the purpose of this study here that I'm showing is a study to determine the effects of this 4DryField on viscoelastic coagulation parameters as assessed by rotation thromboelastometry. Now, what we want to know is that if you have dilution of blood, which can happen when there is bleeding. Anesthetist will then place in a lot of hemodiluents, and the blood becomes dilute. And will this work? And this study shows that the application of 4DryField significantly increases the speed of coagulation and clot firmness, even under conditions of dilutional coagulopathy. With a normal dose of 4DryField, the firmness of clot is 50%. Diluted blood is comparable to that of native coagulum and might be capable to seal microvascular bleeding areas, indicating that even in diluted blood, it works well. Now, I'll show you this video. This is an animal model, and we have made a hole in the liver, and the 4DryField powder is then placed on top of it, apply pressure with a gauze, and then place a little bit of saline on top of it. That's how it's done, and it prevents bleeding. And here is another lesion. There's the liver, part of the liver is being cut away, and then 4DryField is then placed on top of it. The powder is placed. There is some blood here, and that blood is then applied pressure on, and then you place some fluid, and a gel forms, and then it causes hemostasis. And this here, they are cutting the heart, making a hole in the heart and cutting a little bit of tissue of the heart. And in a similar manner, placing the powder will then cause hemostasis in this area. So you can see they can place the powder on top of it, apply some pressure, put some water on top of it, and then a gel is formed and the bleeding stops. So this is how it works. So application notes for hemostasis is that first you clean the blood as much as you can, keep it dry, and then place the powder on top of it. And if necessary, put a gauze on top of it to apply pressure, and then the hemostasis will be achieved. So this is how it works for hemostasis. So the advantages of 4DryField for hemostasis is that it can be used on a large area when there is diffuse bleeding. And for us, laparoscopic surgeons, this is exciting because this applies to areas of deep endometriosis and deep infiltrative endometriosis where a lot of excision is done. We can apply it on a large area, and even in 50% hemodilution, normal physical properties of coagulum occurs. The hematoma is a clot that degrades faster than the native coagulum, so significantly reduces hematoma formation. And there's no animal or human component, so it's very safe. So these are the advantages of 4DryField for hemostasis. But what I'm more interested is adhesion prevention. As a reproductive surgeon, I do a lot of surgery for patients with endometriosis, and we want to look for a product that not only causes hemostasis but also prevents and causes adhesion prevention. Now, we all know about adhesions. We know that it's a major problem. It causes 60 to 67 to 97% of post-op, and even after adhesiolysis, there's 86 to 97% reoccurs, and this is especially so in small bowel. And there's a lot of problem with adhesions post-operatively. But for us as reproductive surgeons, what we are most worried about is when we do surgery around the ovaries, in the pouch of Douglas, and around the fallopian tube. We are worried that the tubes will get stuck and the patient will not conceive. So we are looking for products that will prevent this from happening. Now, this is how 4DryField works as prevention of adhesions. It works in two modalities. Action number one is that it causes rapid hemostasis, less exudation, and less fibrin deposition. And action number two is that it forms a gel, a physical barrier that prevents tooth to surface from adhesions by preventing formation of fibrin bridges. So, there are three ways in which we can apply 4DryField. In open procedures, you can use this and just place it on top of the area where it's bleeding and then apply saline. You can actually mix it. 1 gram can be mixed with 10 mils of physiological saline to form a gel, and then you can apply the gel. I will show you some videos how this is done. And thirdly, this is our favorite part, is you can have a laparoscopic applicator where you can apply on top of the area and then drip some saline to turn it into form a gel. Now, this is the first application where there is a large area and laparoscopically that is being done, and you can apply this 4DryField through the laparoscope on these areas, on this large area. And after that, you can then drip some saline on top of it, and this saline will then mix this powder to form a gel. And this is what is exciting for me. Current available anti-adhesions does not allow us to do this because we can't see the gel formation on that area where we apply the product. And so here you can actually see the gel and on a white area in which the powder has been applied. Now, this is how it is mixed up extracorporeally. If you think that you cannot apply the powder, then you can actually change the powder into a gel. As I told you, 1 gram is equal, should be added to 10 mils of water. Here, all this powder, I think there are three bottles of product here. And then you add the water to it. And then you can turn it into a gel. And then this gel can then be applied either in open surgery or laparoscopic surgery. But studies have shown that if you use the powder and drizzle water on top of it, it prevents adhesions far better than if you do it this way in terms of a gel. So I would advise you all to use the powder in the laparoscopic form and then apply some water to get better anti-adhesions. So it's quoted as more about 95% in that way than if you use a gel form, which is about 85%. Now, here is a patient who has got a laparotomy and adhesiolysis. And when you have done an adhesiolysis, then you can wash and then you can actually apply this gel that I showed you earlier. So you can mix the powder to form a gel, and then you can apply the gel to all these areas where you have done the adhesiolysis. And in this particular case, you can see that the surgeon is drizzling the mixed gel all along the areas where the adhesiolysis is done, because here, if you put the powder, it will probably not get to all the areas. So using the gel will be a better option here. But after placing this gel, we are always worried that the omentum and even the intestines may get stuck to the skin. So to prevent that, what they are doing is that they're placing the omentum on top of the intestines, and then they place the powder on the omentum to prevent the omentum from getting stuck to the abdominal wall. I mean, we all see this when we do laparotomy and when you do laparoscopy in a patient who have previous laparotomy, the omentum will always be adherent. Even the intestines will be adherent to the abdominal wall. So this is the way in which it is done. You apply the powder on top of this omentum and then drizzle some water on it so that it turns into a gel. And once this is done, then you can suture the abdominal wall. So you can see that you can drizzle the abdomen and then you can close the abdominal wall. Now, the next question is, how does it work in gynecological laparoscopy? I think there are very, very few studies that have actually looked at a product and done a second look laparoscopy to see whether the product works. And this is one of such studies. The use of modified polysaccharide for dry-field adhesion prevention and hemostasis in gynecological surgery, a 2-center observational study by second look laparoscopy. So the conclusion is that with the use of modified 4DryField, an immediate hemostatic effect could be observed in persisting oozing after reaction of endometriosis, confirming its hemostatic capability. So modified polysaccharide 4DryField is not only effective in diffuse bleeding. In this cohort with extensive surgery for various gynecological pathologies, 4DryField showed effective adhesion prevention. Its use as a premixed gel is a convenient variant for the treatment of large peritoneal wound. Now I'll show this video that shows one of these cases. This is a patient who underwent surgery and then they did a second look laparoscopy. Here you can see the typical endometriosis case. Here this surgeon has done an ovarioplexy and he has released this ovary from the pelvis. There's a lot of adhesiolysis done in the pouch of Douglas, and this is something that we see all the time when we operate. Now, how to prevent adhesion in this kind of cases? So here, this powder is then placed on the areas that have been operated, and then you can see that the powder is then sprayed to all these areas. This is something that I always find it difficult to do with just gel. If you can put the powder on that area and then place some saline on top of it, you can see that exactly where the gel has formed. And this is the beauty about 4DryField. And in this particular case, this surgeon actually did a second look laparoscopy, and it's actually looking absolutely fabulous. and you can see that 8 weeks later, when they did the second look laparoscopy, the pelvis looks very clean, and you can see that there's no adhesions at all here, and there's no adhesions in the ovarian fossa. And if we can achieve this, then we don't need IVF. The patient is going to get pregnant on our own, and that's probably what we reproductive surgeons aim for when we do surgery for when we do pelvic surgery for pelvic pathologies. Here it can be also used for cesarean section. Here you can see this video, how to prevent adhesions in cesarean sections. You can remove the cap, and in this cesarean section, I was told that they can use only 3 grams is sufficient. So clean the area, and then apply the powder on top of the of the scar. And you can see here the powder is being applied on the scar, and after that it is then drizzled. Let me fast forward this. It's then drizzled with water, and you can see you can drizzle it with water, and this can be one way of preventing adhesions. This may not take up in Malaysia, but there are some patients who ask for anti-adhesions, and this may be another option for patients who want anti-adhesions after a cesarean section. Okay, the next question is, how does it compare to hyaluronic acid? You know that there are many hyaluronic acid-based anti-adhesions available in the country, and many of the hyaluronic acid are not used with what we call as hemostatic agent. They are only anti-adhesion agents, but unmodified hyaluronic acid is subjected to rapid degeneration and at a site operation within hours. So it is not useful to use hyaluronic acid alone. But if you use it with a hemostatic agent, like for example this Medicurtin, they have this HES added to it, and it is shown that this HES actually may increase the prothrombin time. And there is also no RCTs to show that these particular products, hyaluronic acid based products, actually causes prevention of adhesions. Now, I've also come across many products similar to this before. For example, Arista and Hemostasis. People have come and showed me that you can use these powders to prevent, to actually cause hemostasis. These are all very good hemostatic agents, but they are not also anti-adhesive properties. And that's the reason why I'm very excited about 4DryField, because it is probably the only product which is in this powder form that not only causes hemostasis, but also causes anti-adhesion. So it is now available in several products. This is the product, and it is available. There is a attachment for laparoscopy. It comes with 1 gram, 3 gram, 5 gram, and 9 gram. I've been using these two products, 5 gram and 9 gram, in my practice just the last few months. And I'll share with you all one case that I've done recently. Actually, this is my second case using this product from the supplier, the sample from the supplier. This patient saw me in October 2020. She's a 30-year-old lady, married in February 2018. She had a laparotomy and bilateral cystectomy for stage 4 endometriosis done in February 2015. And she was given generation analog for 6 months. After that, in 2019, when she did a HSG, she had a left hydrocephalus. Ultrasound down showed a bulky adenomyotic uterus. There were 2 endometriomas in the right ovary, small ones, and a left endometrioma measuring 2.28 times 1.19 centimeters. Her AMH was 1.96. And this is how it looked. This is the uterus, retroverted uterus, with these small endometriomas. So I told her that if I go in, it is not going to be very easy surgery, and then I'm not sure about her pregnancy rate. So I actually advised her to undergo IVF first before I have to do a laparoscopy. I had to do laparoscopy because she had hydrocephalus. I need to probably remove or release that tube. So she underwent a IVF in January this year. We froze 6 embryos. In March 2021, I did a laparoscopic surgery, and this was a short video of the laparoscopic surgery. As usual, after a laparotomy, there will be a lot of adhesions, And after performing the augmental adhesiolysis, I released all this bowel that was adherent to the uterus, and the uterus was also stuck. There was a lot of adhesions between the uterus and the intestines. And this is the left ovary. There were sutures seen. These are non-absorbable sutures. This is the right fallopian tube that was stuck. And this is what we want to prevent. We don't want this kind of adhesions, which is not going to help her to get pregnant. And the tubes were released. And so all the adhesiolysis were performed, and here the ovary was released from these intestines. Many people are still very keen on using non-absorbable sutures. I've given up using non-absorbable sutures for adhesiolysis. I usually use absorbable sutures nowadays. And here is a small endometrioma, and that was released. And of course, the rectum was stuck to the uterus, and this is usually the most difficult part of the surgery. In my practice, I will completely release the rectum from the uterus and then excise all the disease in the pouch of Douglas. So this is what I'm trying to do now. I've released the whole rectum from the uterus, and there is a large endometriotic and adenomyotic nodule here, and that was excised. So this patient, the endometriotic nodule, which is the deep infiltrative endometriosis, was stuck to the vagina. So a lot of excisions of this disease was done. And there was also a nodule in the vagina of the uterus, in the vagina as well. So here, as you see, I can see that I had to actually go into the vagina to remove all this deep infiltrative endometriosis. Here I've entered the vagina and then excised this nodule. So there you see I'm in the vagina, and then the nodule is then excised. So once this nodule is excised, the vagina was repaired. So here I've already removed almost probably 95% of the disease in the pelvis. I also performed the cystectomy for this patient. The cyst was not very big, and cystectomy was done, and the ovary was also repaired. So after doing such nice surgery, what we are worried about is these things all going to get stuck. So here I'm using the 4DryField to apply it on all these areas, these raw areas that, and I can see that this powder actually sits in the proper position. Although this is only the second case I was using, I'm still learning how to use this. There is some learning curve to apply this nodule. And then when you apply some water, you know that the gel is actually on that area where you applied the powder. So this is at the end of the surgery. So what I did subsequently is to do the embryo transfer. Frozen embryo transfer was done on the July 2021. 2 embryos were transferred. She's now pregnant with twin pregnancy. Now, I'm not saying that she got pregnant because of 4DryField. Many factors are involved. Firstly, the IVF and the frozen embryo transfer might have just got her pregnant. But what I'm hoping for is that my surgery and also the application of the anti-adhesion will cause less adhesions, and the patient will conceive a second pregnancy without any surgery. So that is my hope. So in conclusion, 4DryField offers immediate hemostasis. It allows less fibrin formation, which is a precursor of fibrinous connection between scar tissues. 4DryField hydrophilic microparticles, along with physiological saline solution, form a viscous gels within seconds, and you can see it and you can know where exactly the gel is. This viscous gel becomes a physical barrier on a scar tissue and prevents formation of fibrinous tissues between the scar tissue and other nearby organs. The modified polysaccharide 4DryField remains in the body for 5 to 7 days, which is important, where mesothelial healing takes place, and so that the two surfaces do not get stuck to each other. So after 7 days of the body's amylase digests 4DryField and will be absorbed. 4DryField is very safe and biocompatible, up to 1.05 gram per kilogram body weight, and is well tolerated. Thank you. I think I'm over 22 minutes. Back to you, Kanna.
Yes. Thank you, Dr. Selva, for a very interesting lecture. Wonderful videos as usual. You did an extensive surgery and remarkable. Now, 2 questions. One is that in regards to the Caesar, you had mentioned it can be used for cesarean section. One of the speakers was saying that they're facing adhesions more at the upper part of the uterus compared to the lower part. So how do you apply this adhesive barrier?
I don't understand by the upper part of the uterus. I think the most adhesions occur between the caesarean cesarean, where you do the Caesar and the abdominal wall. I think that is the adhesion. Whether how it happens above or below, we're not sure. But the current practice is that you don't do peritonization. I think that is what everybody is doing. I'm an old school of thought. I trained in the 90s, and I always peritonize my patients. I think that may be a problem. You have a large raw area, it gets stuck. Probably that's one of the reasons. But using anti-adhesions will definitely benefit patients like this. Where it is going to get stuck, I'm quite sure it's because the raw area just moves up and gets stuck on the upper area. There's no other place that is raw enough for the adhesions to occur. That's my thing. That's my thought.
Second question is, you were using saline on top of the powder. What about the body fluid itself? Would that be, instead of you applying all this, would you just leave the body fluid take over the function?
This is a good question. I don't think it will work because the body fluid will have fibrin and other structures, and that are things that we need to remove from the patient. So it's actually good to remove as much of the blood and apply the gel, and then on top of the gel put the saline together so that the saline can be absorbed by the microbubbles and then form the gel form. So it doesn't work with body fluids. It only works with saline applying after the after application of the powder.
Okay, final question, what's the cost?
Yeah, you have to ask the distributors. I don't know whether they'll allow me to say this, but it ranges between 500 ringgit to 700 ringgit for the higher dose, which is 5 gram and 7 gram. These are the ones that I'm interested in. I ordered 5 gram and 7 grams because the 7 grams and 5 grams, the difference is probably about 200 ringgit, and you have a liberty of actually applying to a lot of areas. So that is the cost price to the hospital. Of course, when it comes to you, it might be much higher. So that is the range that we are talking about. And I don't know whether I'm allowed to say that, but I'm saying it on behalf of the distributors.
Thank you so much. Thank you, Dr. Selva, for a wonderful lecture. It was nice having you today morning.
Okay, thank you, Kana. Bye.